and Torie Robinson. Hello. Nice to meet you. Torie is she's a patient and she have the diagnosis of epilepsy, right?
Correct. Yes.
Yes. And so it's lovely to have you both here.
Thank you for having us.
To see you meeting. Yes. And we're on a EIT Health Summit and we talk a lot about digitalization. And you are very much into that, both of you now. Yeah. So can you tell me a little bit about what you were talking about? Torie just had a very inspiring session here now.
Thank you for having us. So I was talking about the benefits of digitalization for patients, families, and indeed the wider public. It provides us often with much easier access to data, can provide us with honestly calmer spirit because it's not so stressful to actually try and access our data and care. Yeah.
And did you hear Torie's session?
Yes, I did. It was very inspiring and also moving because it's a personal story of how you can also get a better treatment and better support in your daily life by having this kind of interactions digitally with your care provider, and also be included in your care journey and understand what's happening next, what happened in my disease and the treatments I've had. And I think that's a lesson for all the care providers, that you need to have that kind of interaction and meet the demands of patients to have both more accessible and also more as a bigger continuity with a choice of your choice of technology to contact, to interact with healthcare. Now we choose for patients. We say that you can use this telephone time, this time of day, or visit us in our time that we feel is convenient for healthcare. Perhaps it's not that convenient for patients. So we really need to shift that perspective, I think.
You live in London. How is the availability of healthcare there?
For me personally, it's wonderful. I'm at Queen's Square Hospital, so part of UCL, and actually that's one of the reasons I moved to London from a more countrified sort of area. We have some of the best clinicians literally in the country who specialise in the epilepsies and indeed the comorbidities, because what's really important for the clinicians to recognise and understand is that epilepsy is not about seizures alone. And personally for me, as for many other people, it can be about the psychiatric comorbidities which contribute to quality of life. It can be down to what job you can do. It can be down to the care that you might get from your loved ones, well hopefully, or your carers. And then indeed it can also be about the quality of life of the carer, because it can be that which is actually more challenging than the quality of life for the patient, many a time.
So would you say that your healthcare provider also include your carer?
Oh no, I don't have a carer.
I mean, or any help or relatives, or?
Honestly, I've been quite an independent person, so I've always just been that person who goes out on her own, shall we say. I'm just like, right, this is who I am, darling. This is what I need. Thank you very much. But I guess I'm kind of the minority, and lots of people need a carer or loved one to come to an appointment with them or access their information online and help them organise things. Also, often many of us have issues with cognitive function and memory, so actually being able to access our data online is so beneficial for that reason. We can remind ourselves this is when my appointment is, or this is when my diagnosis is, and that is equally maybe not equally, but very, very beneficial for carers and loved ones. And they can just, okay, this is my daughter, my son, my partner who is actually being looked after. And then, like you were saying before, having that choice, when does an appointment work for us, and also that we've got this reassurance accessing information online of, okay, I don't need to get up at silly o'clock in the morning. I can be more chilled out. And for many people with epilepsy, that actually reduces your risk of a seizure.
Exactly.
But we do have to be very careful. Many people, depending upon their circumstance, they actually do prefer face-to-face. And we mustn't forget those people. And lots of people, especially with things like epilepsy, they may have comorbidities or intellectual disability which restricts their ability to arrange things themselves, which does mean that, face-to-face appointments can be very important for them. So, yeah.
I think that point is very important to take from the care provider side, that you can individualize and really tailor-made your choice of how you want to have support from healthcare. For a person who have anxieties, well, I don't want to leave my home. Well, okay, healthcare is coming to your home through a digital channel. Or if you have problems speaking in your phone, perhaps we can have a text-based chat instead. If you have visual impairments, you can't see, you can have telephone contact instead. So you choose your method that is designed for you. And healthcare must provide that choice of contact method, I think, for patients. In Sweden, we have you can choose your doctor and where you want your care to be handled, but you can't always choose how to contact that healthcare. And that's my ambition to make that possible everywhere. Then I also think we have to see technology as a tool for freedom, as we discussed in my panel, because technology is often seen as something that you force upon care providers or patients, but still for patients that is the means of freedom. You don't have to comply with the opening hours of your health clinic. You can actually send your data, you can access your data all around the clock if you want to, and also have more measurement points if you have a disease where you have to make measurements. If you have diabetes or other diseases, you can really send data 24/7 to your health clinician, and you can then interpret also how am I responding to this treatment or to this new medicine or whatever. So I think that's a very good way of using data for not only data-driven innovation for providers, but also as a tool for treating yourself and learning about your illness.
Yes. After all, the actual meeting with healthcare is a small part of the treatment,
Yes.
right? Yeah. So about this sharing data, I know you were talking about that too. What do you think about that? Do you think it's important? I mean,
Totally. I mean, I'm lucky in that I get to meet lots of different clinicians and scientists, so I have some insight into how my data might be used. But I also know that that data is mine, and I have the ability to say yes or no. And that means that I can contribute to the health of other people as well as potentially myself, and that it gives you a really good gooey feeling inside sometimes, especially if you have a health condition which can be limiting or can be pretty depressing or anxiety inducing. Now, I also understand that without data, and clean data that is, we can't really expect as quick a change as we may have at the moment, although it's not quick enough, right? And what we need to do is to get other families, patients and the general public more aware of the benefits of using data, but reassuring people that it is safe. The positives outweigh the negatives, but we have to keep giving that message because people just hear the awful side of things. Sorry.
whoops. Please, sorry. Come back.
So, as a summary, we need to reassure people of the security behind our data sharing. We need to be able to actually have clinicians to be able to communicate effectively about what happens with people's data. But we need to be able to point people toward further information about their data, how it will be used, the benefits for them, but often, to be honest, more for other people of the future. And I honestly don't. The one caveat which is a bit worrying for many people is, you have more investors into companies. So what do they want to be done with your data? How might they use it? That's why we have legal requirements, regulations, audits, and we have to reassure people that this is happening again and again and again, and make it public information, and quite frankly promote it, because that encourages people to actually be more involved in research and feel more empowered when it comes to the care for themselves or their loved ones.